Congratulations, you've just decided to have surgery by me for your body and your transformation. I am super excited. There's a couple things I want to go over with you prior to your operation. In general, I want you to be super healthy. This is very important, at least the first 2 weeks prior to your operation, all right? You want to be very calm, even keel. Don't do any fad diets. Don't do any crazy exercise routines. Kind of keep your normal routine right up until the day of surgery. Don't do any smoking at least 6 weeks prior to your surgery, if possible. Don't do any drinking 2 weeks prior to your surgery. That's any and all alcohol. And don't do any illicit drug use at least 2 weeks prior to your surgery. Those things can be tested for the day of your surgery and it could cancel your surgery. Marijuana is okay if it's not smoked, okay? An edible version is preferred because the smoke can cause a lot of problems with your wound healing. A lot of you might be anxious or nervous before your surgery. There's a couple breathing techniques that you can do to help with your anxiety. It's called 4-7-8 breathing. You can look it up online, 4-7-8 breathing. That will help calm you down, especially if there's times where you're feeling particularly anxious. In addition, CBD prior to an operation is wonderful. We sell Wild Health CBD or any type of CBD you can take and put it underneath your tongue. You can start to do that 2 weeks prior to your operation and it will help settle your anxiety. Pre-operative supplementation. Remember, don't take anything that's going to cause you to bleed at the time of your surgery, so no aspirin, ibuprofen, Aleve, any of those NSAIDs that can cause you to bleed. Things that have a lot of garlic in it that could also cause you to bleed, and fish oil. One thing I do want you to take is the Heal Fast preoperative supplementation or preoperative vitamin that we recommend to you so that you supercharge your body so that it can heal faster. If you're a woman over 50 years old and you're taking any hormone replacement therapy, you do want to discontinue this at least 2 weeks prior to your operation to prevent blood clots. So it's the day before your surgery. Get excited, you guys. You're gonna do great. It's important to remember, don't eat or drink anything after midnight tonight, so eat that last dinner and enjoy it, okay? And you can also brush your teeth in the morning with just using a little bit of water, and you can take a sip of water with your medications, but that's it. Please be sure to remove all contact lenses prior to coming in and wear glasses if you need to. Also, if you have any jewelry or eyelash extensions or any piercings on your body, please make sure to remove that prior to surgery. It interferes with the electrocautery that we use for your operation. Also, take a shower before you come in. Let's get nice and clean. Do it the night before, all right? You don't need to use any harsh soaps or whatever. Just use what you're normally used to using, but take a good shower so that you can rest well and be ready for tomorrow. So if you have any body hair on parts of your body that might interfere with where the incisions are for men, for your chest, and for women and men in the pubic area for a tummy tuck, you may want to shave that area 24 hours at least prior to your operation, which actually helps reduce postoperative wound infections. If we have to do it the day of surgery, not a big deal, but it does increase your likelihood of an incisional infection. So try to do that at least 24 hours ahead of time. At this point, you also want to plan for your ride home. Unfortunately, you can't go home by yourself after surgery. You've just been under anesthesia and you can't make any decisions and people could take advantage of you. So you need either a friend or family member, or at the very least a nurse that could be with you when you go home, okay? Uber and a Lyft service is not permitted. They can't actually access our building. You can arrange for a black car service, but you still need to have someone you know with you. If you don't have anybody that can take you home, let us know. We have plenty of people and nurses to make sure that you get home okay and supervise your care once you're home. It's important to bring all of your medications the day of surgery and open them out of the packages so that the nurses can go over them with you in detail. Please be sure to be on time for your surgery. There's about 20 different people here to make sure that your surgery goes successful, and there are other people that might be getting surgery at the same time. Make sure that you plan for that and be here on time. There's plenty of parking available if you do get here early, and we got Wi-Fi so you can just chill and relax. What to wear the day of surgery? Make sure you wear loose-fitting clothing. A zip-up jacket and sweatpants or sweatshirt is all you really need. Stuff that you don't mind getting a little bit bloody, a little bit dirty, and is easy to get on and off because you're not going to feel great right when you wake up from surgery. You want to make that process easy for you. It's important to know that you get to meet with me prior to going back to surgery. We're going to do some markings. We're going to go over any other questions that you have, and we're going to go over your goals, okay? So don't worry about that. We're going to get a chance to talk to make sure that we get your plan perfect.
Hey guys, my name is Colleen. I'm the surgery coordinator here at Barrett Plastic Surgery, and this is just a quick intro video for what you can expect the morning of your surgery. So when you get here, always arrive on time. It's super important, but when you arrive, you'll probably arrive at these glass doors, and so go ahead and open them. If they are locked, which they may be if you have an early arrival time, you can go ahead and ring this doorbell and then we can let you in. So once you're inside of the lobby, we want you to use these elevators to go up to the floor that's labeled M. Once you're out of the elevators, we want you to head in through here. And so once you're through, go ahead and check in with the front desk. After that, go ahead and take a seat and we'll let our medical staff know that you're here for your surgery. To reach our parking garage, turn onto Roxbury. Please keep in mind this is a one-way street. And then you can take a left into our parking garage. All right, so if you guys plan on getting dropped off in the morning or parking, you're gonna enter in through this ramp, and we actually have 3 different spots that you can choose to park in. So you can either park in these spots, or when your ride comes to get you, they can park here, give us a call, and then we'll wheel you out to them. If you arrive and the gate is shut, please give our office a call and we will send someone down to open that for you. So once one of our medical staff grabs you from the waiting area, we'll have you enter a room. From there, we'll have you change into one of our Barrett plastic surgery gowns, and if you're female, we'll have you do another urine test. Once you're back into the room, one of our nurses are going to come talk to you, and they'll talk to you about all the medications you were prescribed and also go over your medical history. After our nurses, our anesthesiologist is going to come in and talk to you as well. Just go over any concerns you have regarding anesthesia and have a little chat with you. And lastly, Dr. Barrett is going to come talk to you. Once he enters the room, you guys are going to be able to go over any last minute concerns you have before going into the OR. He's going to do all of his markings. You guys are going to review your procedure, and then him or one of our medical staff is going to take some updated photos. There may be a little bit of a wait time after, but from there we're going to get you to the OR. Once everything is good to go, we'll go ahead and walk you to one of our 2 OR rooms, and that's it. We're so excited to see you tomorrow.
The most important thing to bring with you the day of surgery is patience. Relax. We're going to take care of you, all right? Things may not run on time, and if that's the case, if you're waiting a few extra minutes or even a couple extra hours, it's just because there might be another surgery ahead of you that didn't go quite as planned, and we needed additional time to make sure that that perfect surgery is done. We would do the same for you, and we apologize in advance if there is a delay in your start time of your surgery. We don't know exactly when start times are going to be, but we do have very defined times where you need to be there to be checked in, to go over all your medications, and to answer all of your questions. If the start time of your surgery is running behind, which we typically don't, we can provide you with an iPad that has all kinds of apps on it, including Netflix. There's free Wi-Fi in the office, and we can also adjust the surgical chair that you're sitting in right on the left-hand side with the controls to make it more comfortable for you, and you can do that yourself. What to eat after surgery? Well, use your appetite as a guide. A lot of people start with clear liquids, going on to soups and then more regular food. There's no specific prescription for this. It depends on you and your appetite. So whatever you feel comfortable with, go for it, okay? Just avoid spicy foods the first 24 hours is my recommendation. Everything else, whatever you feel like eating, go for it. Your body needs that nutrition to heal. So in summary, all you have to do is show up, and we're going to take care of you as soon as you get here, all right? Follow all these instructions and you're going to do fine. We're going to get you through the day. This is what we do. You picked a good place. Have confidence in that, and I'll see you soon.